Dr. Hari Nagpal, what are the disadvantages or dangers of using a massage gun?
No doubt, there are some of the pros for using the massage gun, but there are a lot of cons also.
One of the most viewed things on social media handles is chiropractic videos. Is it safe?
In India, we don't have any course which is giving you a degree in chiropractic.
What are some home interventions that a person can do to prevent something like an ACL?
Don't put pressure on that leg in outward movement.
Thoughts on cold and hot therapy and when they need to be used.
Ice baths are a good thing. Weekly, once or twice, we should do it.
Hey guys, Kevin here on behalf of the Wellness Workshop, and I'd like to welcome you to the Wellness Pod, the official Wellness Workshop podcast and a place where we and our guests chat about all things wellness. We like to keep things simple yet interesting. Myths, truths, fun facts, experiences, and a whole lot more. Where the conversation leads is for us to know and for you to find out. Our guest today is Dr. Hari Nagpal. He's been a practicing physiotherapist for over a decade and has worked with aspiring national athletes and a multitude of general population clients alike. In this episode, we'll deep dive into some key insights in the field of physiotherapy and how you can benefit from it. Ice baths, heat therapy, chiropractors, and more. No spoilers though. Over the episode.
Dr. Hari Nagpal. We've known each other for quite a while now, and I think I got formally acquainted and introduced to you by a client's mom, weirdly, at the time. And I've been personally treated by you multiple times, but I'd like to give you the opportunity to introduce yourself to our audience.
My name is Hari Nagpal, as you know. I am a physiotherapist working from last 4 years in Penji. Before that, I was working in Ponda. So I met Kelvin in 2021, first wellness workshop. Yeah, since then.
And how long have you been doing this for?
I am practicing from last 9 years.
Physiotherapy.
Physiotherapy. Nice.
And have you worked only in Goa, or have you
No.
consulted with clients in different parts
I
of
have
India?
worked in Gurgaon first for around 6 months. Then I moved to Goa. First I have worked in Apollo Hospital for around a year. Then I have worked in Ponda and in Penji, Madgaon, on and off.
So it's been a while for you now.
Yeah.
But in your journey, there must have been certain hiccups or
Yeah.
certain hindrances that you faced. I don't know if you'd say this on just your behalf or you'd say it on behalf of the other physiotherapists or physiotherapists that are getting into the field, aspiring physiotherapists. What are certain hindrances that you faced growing up in this field?
As a physiotherapist, the first issue is to make the people believe actually. That, okay, we can cure you. Because we are not providing any medication or injection. So first thing is I think we have to make them believe, okay, this is how it's going to get treated. This is the main and first thing. And second thing is the duration. Usually if you go to a physician or you go to a surgeon, like you go for a visit, and you have to visit next visit, it should be around 10 to 15 days. But for physiotherapists, at least 3-4 sessions you have to come continuously. So that continuity maintenance,
Consistency.
yeah, and the compliance of the patient is not there. But over the past years, I think it has improved a lot. So people have aware now, and obviously the surgeons and physicians are referring the patients. Earlier the scenario was different, but nowadays it's getting much better. I'll say there is almost 200% change in this. People are more aware. Earlier in the village areas like Usgaon, and if you will go around Tamri Mati side, the people were not aware. But now they know, okay, so we got a frozen shoulder or something, so we have to go to a physiotherapist. It's not going to get treated by medicines or some home remedies.
So the reach of physiotherapy as a field and the importance of it is pretty limited in, you'd say, rural areas, and it's a more urban culture that realize the importance of it right now.
Exactly. Earlier it was like that, but now as the time passes, awareness is increasing a lot.
I've heard the word physical therapy and physiotherapy used interchangeably. What's the fundamental difference?
Actually, if we say for our country, India, both the words are same because we have only one course, basically Bachelor's of Physiotherapy and Masters of Physiotherapy. But if we go out of India, like in US and Australia sides, there are basically two courses. One is physiotherapy and one is physical therapist. So physiotherapist aim is to basically going through the manual mobilizations and joint manipulations and soft tissue releases. Their work basically includes more of a manual work, but physical therapists on the other hand 99% emphasizes only on the exercises, strength and conditioning program, and just to increase the exercises for and to plan the home workout, home protocols for the patient, and to see like if a patient has undergone a surgery, for example, a patient has undergone amputation. So he will go to the particular patient's home and he will check the patient can go to the washroom with wheelchair because the leg is amputated, he can't stand and walk. So basically he will plan all the things according to that. So that is the role of physical therapist there and physiotherapist basically generally.
Consider me a patient right now. Under what circumstance do I approach a physiotherapist if I'm going about my day regularly? And under what context do I determine the frequency of how many times I visit you?
So first I'll start with the frequency. Frequency is basically depend what's the intensity of your injury. Like if your pain is very excruciating, you have 5, 6 on the pain scale, you have 5 or 6 the pain is, and you are getting it continuously, pain is there. For example, we'll consider an injury like you were doing dumbbells and your biceps, you are getting pain. It's terrible pain, you got bruise and everything. You went to a physician or you went to the orthopedic surgeon and he advised you to go for physiotherapy. But now you want to know that how many times should I come? Starting for a few days, you should come regularly since your pain is continuously there. Once your pain is settling down, then you can start with some home exercise and your visit can be scheduled alternate days or twice a week you can schedule. And slowly we can teach you the exercise and you can do it at home. Then we go it like 15 days, once in 15 days or once in a month. So now your second question. When should a person come to physiotherapist? Like if you have not been to any doctor and you are not being like prescribed to do physiotherapy, you should first like you have a pain, for example, you have neck pain and it's not going. You have tried most of the things and it's not going. You are getting numbness and tingling throughout your hand and all. You should come and visit a physiotherapist. That's
At the core of physiotherapy, is it only about relieving muscular and connective tissue stress, or is there a deeper understanding behind what physiotherapy is that people don't really understand?
releasing the soft tissues is a part of physiotherapy, not overall. Physiotherapy basically involves starting from joint manipulations, joint mobilizations to make a patient walk, to plan how the patient is going to move forward. For example, there is a patient, she is now bedridden from last 1 month. So we can't go and we can't release soft tissue. It's basically not going to help. So we have to first start with to see why she is not walking. So we have to start with the movements, general movements, generalized passive movements, joint manipulation to make her sit first, stand, make her walk, and then she is having somewhere pain. We can release the soft tissue. Like that.
Right now, as I talk to you, I can see a massage gun on the table.
Yeah.
And I know that as of 2024, at least post COVID, the massage gun has become an essential staple in everyone's home.
Yeah, that's true.
How can it be used? And for someone that does not know how to properly use it, what are the disadvantages or dangers of using a massage gun?
See, no doubt there are some of the pros for using the massage gun, but there are a lot of cons also. See, in Hindi we say, अति हर चीज की बुरी होती है. So basically, to use anything in excess is very bad for your body. Anything. So, for example, we'll see the massage gun. So I actually put it purposely so that you will ask the question about it. So the attachment we have here, it is a U-shaped attachment, but most of the people who are using it at home, they use it as to get the muscles relaxed. So they use the oval shape attachment here, like a shape of an egg it comes, a circular one, and they start just pounding the muscle continuously and they feel relaxed, no doubt. But they don't understand the negative impact they are putting on their muscle. Now, for example, this is the muscle. If somebody is punching you continuously, you will start getting pain, you will get a bruise. Same thing is with our muscle. Now you're continuously, the intensity it goes like this. So if we'll say in a minute might be 100, 150 times we're doing. Now think like there is a round shaped thing that is punching continuously your muscle. So it is definitely going to give you any relief. So it's a good tool, no doubt, for gym also. You might also be using it. For gym people, it is a good, but to a limited
You have to
extent.
know when to use it and
Exactly.
when to draw that line.
And where to use it. This you can't use on the nerve endings. You can't use at the
Interesting.
bones. You can't use at the insertion of the muscles. You can't use at the small bones. For example, if this bone, you can't use at your wrist. You will get a severe terrible pain because there are small 8 bones are there, and you don't know what you are damaging. If you will push it at a nerve, you start getting numbness and tingling throughout your hand. So you should know when to use and how to use.
This is a bit of a funny question, but if a physiotherapist has an issue, who treats the physiotherapist?
Nobody treats physiotherapist.
Because I can understand sometimes you go through those pains, you know exactly how to diagnose it, but then you wouldn't know how do you like do the whole needling and the treatment onto yourself.
Sometimes, yeah, but most of the time, like we use self-stretch and self-mobilization, so that helps a lot.
When working out, okay, a lot of people go to the gym these days. What are certain indicators that they can look out for where they feel, okay, I probably need to visit a physiotherapist?
Any kind of pain, like which is not equal in nature. So, equal in nature, I'll just tell you, like for example, you're getting some pain here. You have done some dumbbells or you have done some bar exercises.
Like curls.
Yeah,
Right.
you have done like 3 out of 10 pain here.
Okay.
But on this end, you are getting 4, 5, 6, and it is not getting equal. So it doesn't mean that it is your exercise so it means you have injured some of the things here, and you should visit a physician, a doctor, a physiotherapist, and you just consult it once. Because if you will not consult it today, it will going to aggravate day by day. So I think that's the point where you should consult.
When do I know if I have to visit a physiotherapist or an orthopedic surgeon? Because today I feel a lot of people that just have a small pain say that I need to get an MRI, I need to get a scan done, I need to get an X-ray done. But sometimes it's a lot simpler to diagnose than what they feel it is. So what's the fundamental difference?
See, if you are getting a normal pain, yeah, like normal pain in the sense, and I'm saying normal pain is like you got a pain in the knee, you are having a treadmill and you are going, then the pain started. Now, if with that pain you are getting difficulty in walking, you got some crack sound, and you are not able to walk, you should first visit an orthopedic surgeon. The reason is, always an orthopedic surgeon will tell you that you have injured or break some of the thing inside or not, because it might be a very severe or heavy injury. But if you are getting like slight pain, you are doing the treadmill and you got spasm in your thigh, you can visit a physiotherapist, and a physiotherapist will consult you, he will assess you properly, then we start the treatment. But if there is something wrong going on, so we can.
So if it's something more of an audible pain, like you've heard something pop or something crack, it would be safer in terms of a joint related issue to go to an orthopedic surgeon.
Exactly.
But if it's a muscular pain, it's more physiotherapy oriented.
No. Like for example, if you sometimes you feel a crack like in the knee, which is very normal. But sometimes when you are doing treadmill, you are doing, or you are playing a football, you get a twisted pain. With that, you feel a pop. So, for example, in the knee cases, if you are feeling that, you should visit an orthopedic surgeon first. That is the safe and the first choice should be. If we will go through the MRI or certain test, then you should visit a physiotherapist, this is the best way you should deal with it. Basically, if you are getting like, in a funny way, if you got a fracture, you will come to a physiotherapist. That time we can't do anything.
Right.
So that time you should go. When a pop sound is coming from any joint which is irregular, like some things we get from our elbow or we do it from neck, which is normal.
That's synovial fluid
Yeah.
that's popping, right?
But if those things are not there and you got suddenly something back and it's paining very badly, you should visit the orthopedic surgeon as quickly as possible, and then after that you should come to a physiotherapist.
You said the pop sound, something automatically rung into my head. In today's day and age, one of the most viewed things on social media handles is chiropractic videos. As a physiotherapist addressing chiropractors in general, what do you feel differentiates your practice from theirs, and how lucrative is being a chiropractor today? Is it safe to go to a chiropractor? What are the possible benefits? What are the dangers? Because today, going to a chiropractor it's almost like a trend.
Yeah, it's like a fashion.
It's okay.
So I am going to go detail in this. Okay. So first of all, in India, let's say in India, we don't have any course which is giving you a degree in chiropractor. There is no course has been introduced by any university or college till now in India. And second thing, chiropractor, how it works basically, for example, my finger, I'm breaking, I'm getting this sound. Same thing the chiropractor is going on. He is basically giving pressure release to your bones. You will go today, you have a pain in the neck, he released the pressure today and you got fine. But what about after 4 days? You're going to get that pressure is going to be there again. You can't go frequently. For example, you can't go for next 5 years every 4 days there, no? Which is not possible. So they are basically relieving the symptoms, not the root cause. You're understanding? They are basically, okay, Kelvin, you have a pain in the elbow, come, we'll do tick tick on the elbow, went home, done. Next day, we got it on the shoulder, we did tick tick, done. No. But why it is coming? First, the diagnosis is very important, then resolving the symptoms, I think, which is not happening there. And I'm not saying it is very bad. No, definitely it gives you relief. It relaxes you for a time being. No doubt it gives you relief, but not for a prolonged period, and it is not the solution, I'll say.
What are some of the dangers that can be associated with
Chiropractor.
chiropractic?
No offense, but if a chiropractor has not gone through your history, and for example, any XYZ person has a osteopenia or has a grade 4 arthritis, rheumatoid arthritis, and for example, he has in thumb, and the chiropractor is doing, it might lead to a severe injury, it might lead to a severe bone injury also. These type of things can happen.
Motion is lotion, movement is medicine. These are phrases that have been used by a lot of people in the exercise science backing. But when we are usually injured, the first thing we're told by doctors and physicians is to stay at home and do nothing. But even while being treated by you, one thing I've noticed is that you have a very counterintuitive notion towards that, wherein you feel that one has to move in order for it to recover. And I know clients of mine that have been treated by you that have addressed the same thing and said that doctor has said we have to move because by sitting stagnant it's not going to help. Please address.
The first issue is immobility. Basically immobility, we'll say. Immobility, we tell patient to be immobile. The reason behind that is, for example, a person got a disc injury at lumbar area and it's very severe pain. In that time, if I go and I'll say, okay, no, you have to move. No, he is going to damage the nerves. He is going to damage the disc more. We don't know how much he is. So, in those injuries, we have to tell the patient, okay, you have to take a rest. Other injuries which the patient should take a rest if the pain is not going by medicines also. For a time being, he should give it a rest. Okay? Grade 1 ligament injuries, grade 2 ligament injuries which are treated by without non-surgical approach, you should give it a rest before at least 15-20 days before starting the movements again. And some of the things where we say, okay, you have to move is frozen shoulder. Frozen shoulder basically, as the name you will be understanding, the frozen means, okay, your joint is going to freeze.
Right.
So in that time the patient usually just keep on doing this. So if a person is doing this, you will understand, okay, he is getting the frozen shoulder. Now in this moment he sits for hours because he is getting terrible pain. But that is not the solution there. He has to first come to the physiotherapist, he has to start the treatment, and main is movement. Movement is very, very important when you are getting these things. Anything, frozen shoulder you are getting or tightness in the muscles you are getting. And in that time, if you are making your body immobile, it is going to be very difficult to treat, I think.
It's very interesting because the first diagnosis we get from a physician if we go is just sit at home and you'll get better over time, just rest. But I notice that you have a very different approach towards it where, and now I understand why, it is circumstantial. So not every situation would require you to move.
That's true.
It's some. That's great, that's really good. What are the most common injuries? I'm sure you've treated a lot of sports personnel as well because you've told me from your background that you worked with a lot of athletes. What are some of the most common injuries you've seen?
Uh, we'll go by the sports. So first we'll go with the cricket. Okay. So cricket, I have seen most common is tennis elbow, supraspinatus tendinitis, shoulder injuries, and ATFL ligament injury in the ankle, which is the most complicated thing to treat, and it is very painful. And this is the same injury which at least 60 to 70% of footballers get. It is basically a big ligament in the side of your ankle. It gets twist and starts getting tear. The name of the ligament is deltoid ligament. We call it ATFL. So that is a very common injury a person can get in ankle. And second most common injury is ACL tear, which almost I think every good footballer who is playing football like every day, he gets. It's very simple to get. You just have to twist your knee in the interior position while kicking the ball, and you put the pressure on this ACL knee.
What is something that one can do, even a general athlete? I mean, not a lot of people can afford to regularly come to a physio. What are some home interventions that a person can do to prevent something like an ACL? Just remedial measures.
To first I'll answer your question. To prevent ACL, you are playing football or any other sport. So you have to first avoid any outward kick you are doing. Don't put pressure on that leg in outward movement. So basically, when your legs are not straight, don't bend and try to sit on them. Okay. First is that, and second, home remedies which you can do. There is a protocol like rice we say. So rice is first is rest, icing, compression, and elevation. So for example, you got some injury in the wrist and you can't go to a doctor or physiotherapist. So you just have to give it a rest. You have to put some ice over it, put some crepe bandage, and just slightly elevate over a pillow, and it might improve if something big is not there.
For someone that trains on a daily basis, what is the importance of a good warm-up and cool-down routine?
Good warm up and cool down routine is very important, because if your muscles, for example, a baby is sleeping and you just make him stand and you say you start playing or you go to school, he will not understand what is happening. Same thing is with our muscle. For example, my biceps is sleeping and you just gave me a 20 kg of dumbbell and I started doing this. So he doesn't know what is happening.
Right.
And you will definitely going to get an injury. That's how the injuries started. Warm up at least. For example, if you are doing 1 hour of workout, you have to give 20% of your time to the warm up and 10% of the time to the cool down. 70% of the time to your workout. For example, 1 hour, so at least give 12 minutes to your warm up and in the end 6 minutes to cool down.
Would you say that that is the optimal ratio for every person to follow?
Initially, you should give. You can give more also. For example, you are giving 2 hours of exercise you have to do. So at least give 20 minutes to warm up all the body. It's not like today I am doing legs, so I am just giving workout to the legs. No. You have to go all body. For example, neck, you have to start shoulders, elbow, wrist, your back, stomach, your legs, your knees, everything you have to warm up. Then you start the workout. And cool down, obviously, it's very important. Some light stretches you can do in the end. And if ice bath is available, you can go through ice bath, or icing you can do normally to cool down your body if you have done very heavy workout. This thing you can go through.
Speaking of which, ice baths is another thing apart from the massage gun that's become incredibly popular now. What are your thoughts on cold and hot therapy and when they need to be used?
So cold bath will go first. So ice bath nowadays it has become a trend. Like you've seen many Instagram videos that people are going in Antarctica or somewhere and they are taking a dip inside for a minute and coming out. So it is actually a very good thing. Not going to Antarctica, just going to ice bath.
Unless you have the money.
Exactly. So ice baths are a good thing. Weekly once or twice you should do it. But if you are a high level, high intensity athlete, you can do it after your workout every day also. 1 to 2 minutes, maximum is 2 minutes. You can start with 10 seconds, minimum 20 seconds, 30 seconds, as per your body allows you. Maximum you should go 1 minute 30 seconds, 90 seconds or 100 seconds. Don't go beyond that because it is very chilling. Your body just goes numb. Within first 30-40 seconds, body goes numb.
They say that the inflammation that is brought down by the ice bath though can have go against. I don't want to reframe this negatively. I want to ensure that I have my facts in place. But they say that it can counteract the hypertrophy mechanisms because the inflammation that is necessary for building muscle is then shortened because of that cold plunge, because it rapidly brings down your body temperature and the inflammation. So because that inflammation response is taken off, does it negatively impact your possibility of building muscle?
No, because ice bath basically we are using, I have said, high intensity athletes. It is started with actually cricket and football. Whenever they play a match, they have to go through the ice bath. This is the like international protocol. You have to do ice bath.
Right.
The reason is when you are playing, you never know. Like a player is taking a dive and taking a catch. He might have got 10-15 inflammation during that process. He don't have time to go and just check the body, go through the scan, he has injured something, he doesn't have a time. He has next day to plan, or if he's a test match, he has to play next day also. So he has to go through the ice bath to reduce that inflammation. If you are going to the gym, you are doing like 1 hour of good workout video and you want to pump the muscles, you don't have to go through ice bath. Wherever you are feeling slight pain or soreness, just apply ice. Don't go through the ice bath. So there is a difference. When you are just applying ice, the hypertrophy mechanism doesn't activate because our body has to remove the temperature down.
So, categorically between athletes and the general population, you say it's more important for an athlete to have an ice bath simply because of the proximity of their training session, because they need to recover, and for them building muscle is not the only goal that they have. They have to perform for sports, so whatever contributes to the bigger picture for them.
Exactly. The athletes doesn't have a goal that they have to increase the bulk of their muscles. They have to focus on their goal. They have to focus on their match. So for them, ice bath is a way to reduce the injuries, to reduce the chances of injuries they can get next day. It is not according to the muscle atrophy.
And heat therapy?
Heat therapy we uses when there is a chronic conditions. Basically, if a condition is like from month old and the patient started getting pain again, so we say okay, you can go through the hot compressions. And for example, a patient is in Jammu, where the temperature is very low already, and it's winter. The patient got injury. We can't tell him to apply ice because it's already very cold, and already there is vasoconstriction going on. Basically, the blood supply is less to that
Limited,
area.
right.
So to make it normalize, we say you go through the hot compression.
Interesting.
So most of the people think that wherever we go, it will be safe.
Right.
No, it always according to the weather and the conditions what the person is there.
Very interesting. One thing that has, I wouldn't say irritated, but frustrated me over the last couple of years is that general physician usually recommends people over the age of 50 or 60 to just walk every evening, and that fulfills their exercise and their cardiorespiratory requirement. But on the other hand, when they're dealing with sarcopenia and age-related muscle loss, it's a crucial thing for them to even exercise, even the upper body and stuff like that. So what are your thoughts on that?
So walking is actually very important after the age of 50. Before that, whatever you are doing in your body, whatever you're doing with your body, you can say, okay, I'm busy at work. Okay, you are not doing any physical activities, is fine. But once you reach the age of 50, you have to start your body functioning. The reason is you don't have that energy, your muscles don't have that length to go through your everyday, your activities of daily living. So at least with 15, 20 or 30 minutes of walk, you are at least doing some of the activities for your muscle. You are not just keeping them sleep. Because then your lifespan, and always Kelvin mentions, your longevity will reduce. You might have a lot of years in your life, but you don't have that quality of your life. Your quality of life start reducing if you will not go for everyday walk. You should do it every age, but after the age of 50, you should walk.
Isn't it also important for people who are getting older to also weight train because their joints and muscles are getting weaker?
Yeah, that's true. In the old age, for example, I see many of the people, I have patients also who are 52 and they are doing very good workout. Like they are lifting in the chest, they are lifting 50 kgs, they are lifting 30 kgs dumbbell at the age of 52 also. I'm not saying they are doing bad, but their muscles doesn't have that kind of strength.
Capacity, right?
They are not realizing it right now, but they will realize when the muscles will start getting torn, or muscles will start getting, the fibers will start getting tired, or they started getting regular spasm, then they understand.
But isn't it important for, as you get older to have a weight training regime in place? Because, like, even for example, the upper body, if your upper body is not trained while you get older, and just by walking, and isn't the muscle going to go through atrophy, and then your joints get weaker unless they are loaded?
See, weight training is very good, but one should know the intensity.
Right.
Like for a person now, we have a trend. Okay, I will do it at home.
Mm-hmm.
I'll buy home gym from the Amazon and I will do it.
Right.
No, it doesn't work like. You should know a properly trained person who should know. Okay, this person has turned 55, so his body weight is, for example, only 60 kg, and you're trying to lift 50 kg weight already. You will get a pop-up sound, you will get a fracture, you can get anything. So you should know when to do what, which is, I think, only possible if you are a particular trained person from that.
So you feel it's important to get like a personal trainer if you're an older person,
Exactly.
at least to monitor your movements.
Yeah, if you are going like even after the age of 45, you want to do weight training, always you should have a proper supervision. Don't try to do it by yourself because you are healthy. You never know when the injury going to come.
If you could give me 3 tips right now for the general public on maintaining their muscular and joint tissue health, 3 takeaways, what would it be?
One is self-stretch every day, self-release your muscles every day, and whatever happens, either COVID happens again, whatever happens in your life, whatever happens, you have to go for a walk every day at least for 30 minutes or 3,000 steps. You have to. Whatever happens, you have to. If you start making this as a goal, your life will change to at least some extent.
Dr. Hari, that's our time. Thank you so much for taking the time out to address a lot of questions that not only I had, but I'm sure the general audience had as well. If you want to reach out to Dr. Hari, we're going to link his Instagram handle in the description so you can reach out to him directly. He's based out of Goa, but I'm sure he consults online as well. But for now, it's the end of the podcast. Thank you so much.
Thank you so much.